certainly with immunotherapy, there's a lot of opportunity, and right, what we're hoping for is that durable response, but we also know that there's certain toxicities that are certainly specific to immunotherapy. And just a couple of comments on how you manage immunotherapy-related toxicity for our patients with HCC.
Yeah, I think, that, and also like one question of duration of treatment. Those are like two big things, which are actually kind of exciting that we have those discussions, because we really never got to have them before, right? But right, absolutely, like immunotherapy related side effects are, yes, they are way better than side effects of TKIs in general for patients, but they can be serious in certain group of patients. So remember, like, so the durva-tremi, right, there is about a 35-40% rate of grade 3 adverse events. They usually happen in the first 3 months, right? So if the first 3 months are okay, that's like the hard period. If they do okay in the first 3 months, then they're usually going to fly and have no further problems with it. The atezobev, similarly, like most of the bevacizumab side effects happen early on, the hypertension, any other issues that come with it, bleeding, all these other problems. The atezo leading to immunotherapy side effects happen early on too, for the most part. Like usually it's rare to have late side effects. Taking care of thyroiditis and issues related to gland malfunction is difficult to identify if you're not attuned to it, but very easy to treat once you identify that. So, that general fatigue problem that patients come with, and trying to make sure you work up them from an endocrine perspective is very, very important, because it's a very, very easy fix for our patients. And I think that is, and which can help them be on treatment for a longer time. It's just is useful, and it's really no long-term consequences, and patients do really well with it. Having problems with the tricky part is hepatitis and pneumonitis. The hepatitis that sometimes associates, is it the disease getting worse, or is it hepatitis from the drug, which is a little difficult to tease out. But obviously sudden changes, HCC doesn't lead to changes in 2 weeks, but if it's happening, then you always have to keep your alert about immunotherapy related hepatitis. There's a really good treatment options out there now. Like you have a lot of new drugs that are out there that help reverse these side effects over steroids over time, that have improved significantly. We just have to make sure that we know and we find this and look for these, and if we find it, we treat them effectively. And there are the other side effects of which are rare, obviously, but for the most part, the ones that I worry about the most is the colitis and the GI and the hepatic side effects, for the most part, is what I've seen.
I totally agree. And, as always, early identification of these side effects and early cessation of therapy, will always result in better outcomes. But exactly, I don't have a whole lot more to add than that. I thought that was really comprehensive.
Yeah,
Dr. Vijayvergia, thank you. Oh, yeah, please.
One question for you.
Yes.
Duration of treatment, right? So I think
Yes.
you all talk about, in both studies, in the IMbrave trial as well as the Himalaya, patients were continued on treatment until progression. Fortunately, when we are seeing our patients, we have patients who are 2 years out and who don't, the typical teaching that is from other disease areas is that if 2 years they're stable, you can withdraw immunotherapeutic drugs in patients. Is that something, obviously there's no data to say that, I'm telling them, but is that something that you've thought about in your patients, and have you thought of that?
Absolutely. And again, amazing that we get to have this conversation. But every once in a while, you will have these exceptional responders where two things may happen. Of course, if you have a complete response radiographically to disease, that's obviously phenomenal. But we also sometimes run into this issue where you can see that the change in character of the tumor radiographically is totally different.
Mhm.
You wonder how much of what you're measuring is either scar or even tumor necrosis. And I do have, luckily, a handful of patients that have had these just wonderful responses to immunotherapy. And right around that 2-year mark is when you and the patient are trying to figure out, well, now these visits are becoming so routine that, you're seeing them for 5 minutes, high-fiving, and then you're leaving. But the question really becomes, do I really need this therapy? So many of my patients, I think, are sometimes just scared of
Two,
rocking the boat.
even me.
Yeah, doctors included. But the other part to that is, I think there are two strategies there. Obviously, if somebody's tolerating therapy really well and everything's going well, you don't have to rock the boat, right? And just like you said, Dr. Vijayvergia, you don't have data in this situation. Of course, the other thing, right, is that these treatments are expensive, they're time consuming. We're asking a lot of our patients. And so, in those situations, having a cessation of therapy, a break, a treatment holiday, followed by, relatively quick re-imaging, right? Imaging at 6 to 8 weeks can sometimes put everybody at ease, because, you're you're stopping therapy, but you have really, really close surveillance. And in that situation, you can see, okay, well, if there's no change and everything and the tumor marker and everything is kind of staying stable, you can continue that break. And so, yeah, I think it's definitely something to consider. And I would ask you what you do in your practice as well.
Yeah, exactly. I just wanted to make sure that, you know, I'm not the one-off person doing it. But no, I think that's what I've heard, and that's what most of us do when there's lack of evidence is, you know, take a cautious withdrawal is what we do of the therapy. And just for a group of patients, you know, there's, like I said, they have side effects from it. Fatigue, you know, the fatigue is one side effect that comes with these set of drugs, and it is, to some degree, like there may not be any endocrine abnormality, but they still are really fatigued from the therapy. And that is something that really can get better if you actually take them off of the drugs. Or hypertension, which is like leading them into hospitals every now and then, or having them on 5 different medications. And these are the reasons I even think about. But if not, then I just let's not rock the boat.